My name is Dr. Marcella Daye, and I'm an academic with interests in place branding and also, more recently, in the area of participatory action research. In recent times, I have been focused in terms of my research in the area of health inequalities, particularly in terms of understanding what are the barriers to ethnic minority groups, in particular in terms of their health and well-being. I'm passionate about the area of equality, diversity, and inclusion, and that's how I entered into this area of health inequalities. Well, I've been inspired to become an NHFT public governor, particularly as well because of my original focal area of interest, which is in place branding. Let me look at Northamptonshire, the place, and what are some of the local issues with regards to health inequalities. How then can I situate myself in terms of finding solutions? I saw an opportunity that popped up, I think it was on social media, and I said, wow, I didn't know this existed, and so I explored it a little bit more, and then it was just luckily for me a time when they were recruiting. So I applied, and thankfully I'm in. Deepening my understanding and having a much clearer picture of the complexity of the NHS. For me, the greatest reward is the fact that this learning and knowledge that I have gotten, how it then informs my current research interest and how I can link that to the area of health inequalities. And that to me has been a tremendous opportunity. I would say that the time has come in terms of addressing the issue of health inequalities. And I think particularly now with the launch of the NHS 10-year plan, with the shift and emphasis on neighborhood health, it's an opportune moment for NHFT to really continue to do the work they're doing in terms of linking with communities and making sure that in terms of the decision making, the various kinds of adjustments that are being done in terms of care, that there is that openness and willingness to engage with our local communities. I think it's for anyone who has a passion to help their communities, to make a valued contribution in the area of health. We need to have our voices heard in terms of decision making locally. Being a governor gives you that opportunity